Well, hello everyone. Thank you for joining us today. We are at PAM Rehab Hospital in Round Rock, Texas, and we are with the lovely, talented Kimberly Whitmore, occupational therapist.
Yes.
And hand specialist. Did I get that correct?
Yes, that's correct.
Excellent. Our focus of the video today, it is April, and that is National Occupational Therapy Month. So it is our way of celebrating and honoring folks in that profession and learning a little bit more about what it is occupational therapists do and the benefits of receiving occupational therapy. So Kim, please tell us a little bit about yourself and about PAM Rehab.
Okay, well, I've been an occupational therapist for 39 years and came here 4 years ago to work at PAM when they first opened. Initially started upstairs in our inpatient rehab unit and helped get that going with the long-term goal that I'd be in outpatient therapy here after we built up the caseload. So now we have a full caseload and 2 full-time OTs and outpatient.
That's terrific. So PAM Rehab, it is a phenomenal rehabilitation hospital, IPR, here in Round Rock. And you have both an inpatient setting
Yes.
for therapy as well as an outpatient. So
Yes.
tell us about the difference.
So our inpatient unit is 40 beds, and typically patients are admitted for a stay of 2 to 3 weeks after maybe a surgery or an illness, a stroke. They'll stay there 2 to 3 weeks to try to get safe, to get back home with their families. And then typically after they go home, they still need some ongoing therapy. So they'll come to our outpatient clinic, usually 2 to 3 times a week, and they can get physical, occupational, and or speech therapy in their hour one-on-one sessions. And our goal is to get them back to their baseline or doing the activities they were doing before they had their illness or their surgery that landed up in the hospital to begin with.
Perfect. Thank you so much. Occupational Therapy Month, it began, the recognition began in like 1980, I believe it is. And it's just to celebrate and honor, again, that vitally important work that you guys do on a day-to-day basis. Tell me a little bit about what is occupational therapy?
A lot of people think we help people get jobs, but that's actually your vocation. So I like to talk about what occupation is, first of all, and then it kind of explains itself. Sure. So your occupation, regardless of your age, is basically the activities that you do from the time you get up in the morning till you go to bed. It might be getting up, getting dressed for work. It might be working for a child. It might be going to school. It might be the leisure activities that you do, like golf or tennis. It might be parenting. So those are all occupations. They're, can be very basic things like being able to feed yourself and get dressed, or they can be more complicated work type activities, but that is occupation. So the occupational therapist, our goal and our role is to help people go back to those occupations and roles and activities that they were doing before. And we do use a variety of different techniques or methods to get people there. We might just do education and training. We might use therapeutic exercises or activities to accomplish those goals. We might also use adaptive equipment. I brought a couple of pieces of adaptive equipment to show you. So for someone who maybe, for whatever reason, would have difficulty holding a spoon, we have built-up utensils that we might prescribe that they use. Or if they have difficulty keeping their food on their plate when they're eating, we have plate guards that can be snapped on. So that would be an example of adaptive equipment that we might have someone use to improve their occupation of feeding themselves.
And their insurance or their Medicare would pay for this sort of equipment potentially?
So typically, Medicare does not cover small pieces of adaptive equipment like this, but when we're working with patients in inpatient rehab or outpatient rehab, our facility typically includes that as part of the care, the smaller pieces of adaptive equipment that patients might need to accomplish their goals. So it's included in the cost of their therapy or their care. Typically insurance, and it depends on the type of insurance, will cover what's called DME or durable medical equipment, as long as it's medically necessary. So that would be things like a hospital bed or a bedside commode or a wheelchair or a walker, things that are more costly.
Okay, thank you. That's
Yeah.
great. What about the difference? So I'm sure you get this a lot. What is the difference between occupational therapy and physical therapy?
Well, I always like to use the example that physical therapy works more on getting people up and moving, and then occupational therapy focuses on what they're going to do when they get there.
Okay.
So, for example, physical therapy might work with a patient so that they can walk to the bathroom and work on their leg strength. And then occupational therapy is going to look at, well, when I'm there, can I get in and out of the shower? Can I get up and down from the commode? Can I stand and brush my teeth while I'm there? So we kind of look at more activities and what I described as occupations before, where physical therapy is typically more focused on the motor aspects, the walking, transferring, getting up and down, and strength.
And then let's touch on some of these. I'm sure they're called a variety of different things, but 8 areas of occupation that OTs are typically trained in.
So occupational therapy looks at what we call basic activities of daily living.
Okay.
So those would be things like bathing, dressing, grooming, feeding yourself, brushing your teeth. We also look at instrumental activities of daily living.
What's an example of that?
So an example of that might be preparing a meal. And another example might be mowing your grass, doing your yard work, paying your bills. Things that typically, other than basic self-care, that you are required to complete to get through your day.
Okay.
Work is another big thing that we can address in occupational therapy. I actually did on-site therapy at a major automotive plant for a while.
Tell me about that.
Yeah, that was really interesting. So if they saw they were having a lot of work-related injuries on a particular line in the plant, I would go in and do an activity analysis and try to determine what might be contributing to those injuries.
Okay.
Maybe it's shoulder pain or wrist pain. A lot of patients with carpal tunnel syndrome. So we would make recommendations for possible modifications to that line, or maybe a special equipment that the workers might need to wear, and they would implement those things into the line. And then the other thing we did is, if someone was injured on the job, we would work on rehabilitating them to get them back to their jobs.
Okay.
So if they had to use their hands a lot and had a hand surgery, we would work on grip strengthening, fine motor coordination, those types of things to help them get back to their job. And we did that all within the plant in a clinic.
Wow. So not even in a clinical setting.
No, we were actually on
site.
Yeah.
That's very unique. Also, education is another area.
Well, a lot of occupational therapists work in the school systems. I did that for a couple of years as well. Our role is to look at what is the occupation of a child. It's being able to learn, interact with their peers. And so a lot of children, because of developmental disabilities, birth injuries, they have difficulty being able to participate in the classroom environment. So we may work on things like developing improved attention span, handwriting, if they have issues with that. Some children don't have trunk control to be able to sit up in their chair, so we might work on those kinds of things. I even had one child that had issues with apraxia or motor planning, that could not coordinate changing classes, being able to get his books out of the locker and get down the hall in between classes without dropping things. And so we worked with him a lot on motor planning and being able to modify that particular activity so he could get from class to class. Work a lot with the teachers and consult with them quite a bit.
Wow. What a tremendous career.
There's a lot of variety. That was one thing that drew me to occupational therapy when I was a student, was the fact that there were so many different avenues. If you lost interest in one area or didn't feel like it was a good fit, there was always another area that you could go to refresh yourself in your career and make a difference in a different way.
Very interesting.
Yeah.
Leisure? Tell me about that.
Well, I worked with someone with that just this morning. I had a lady that was playing tennis, and she fell and really injured her wrist and her hand quite a bit. And she is also an accountant and has to be able to keyboard. So I evaluated her today. And part of that evaluation is you're looking at their medical history, what happened. You're looking at what their deficits are. She had a lot of pain with particular emotions. She had poor grip strength. And so we look at those kinds of things, and then we look at what their goals are. Where her goal for therapy was she wanted to get back to tennis. And then she also is an accountant, and she was having a lot of pain with keyboarding. So we looked at what her goals are, what her deficits were, and today I made her a little wrist splint. This is an example of a splint that it starts with a flat piece of plastic, and we heat it up and form it to the hand. So she was having pain when she was keyboarding, when her wrist would go to the side and her small finger would go out. And she's like, if I just had something that would keep my wrist from moving when I was keyboarding, then I wouldn't have so much pain. So I was able, this isn't her splint, but I was able to make her a very specific splint that she could use that would block that motion but still allow her to be able to keyboard. So we heat the material up after we make a pattern and we form it right to the hand, and it takes, they're all custom made. So she was able to keyboard with less pain then.
That's true. That's awesome.
Yeah. So, and then we're working on trying to find something she can wear that's more flexible when she's playing tennis and throwing her tennis ball up so that she doesn't have pain. So that was how we were addressing her occupational goals.
Very interesting.
Yeah.
So tell me a little bit about what can someone expect when they get into occupational therapy for an appointment?
Okay. Well, like I said, the first appointment is initial evaluation, where we're, again, talking to that particular individual about why they were referred to therapy, what is their biggest concern or issue, just trying to get to know them better and to know what kind of issues they're having and what their goals are. Then that helps drive our assessment. It helps us determine what kind of measurements we need to take. It helps us determine what kind of outcome measures so we can see if there is progress that we need to do, and it helps us establish our treatment plan. So that's the primary thing we do on the first visit, but I'll also try to do a little bit of treatment as well. So that way they go home with something that's going to help them and it helps them buy into the process. Then they might come back 2 to 3 times a week for therapy. And depending on what their needs are, that's when we start their activity modification, make their splints, do their exercises.
It's very involved.
Very involved. And typically they'll do that 2 to 3 times a week as an outpatient.
For how long? It just depends.
An average amount, it is very varied depending on what their diagnosis is and what kind of issue they're having. But it can, we've seen patients as few as maybe 4 weeks. And we've been following patients for a year, but that is very unusual that insurance companies will continue to cover services for that long. But
perfect.
Yeah.
Give me some examples of occupational therapy that most adults would typically do.
Well, again, it depends on the diagnosis. Maybe a typical occupational therapy might be someone who's had a stroke or cerebral vascular accident. A lot of times they've lost use of one side of their body. They can't move their arm very well or not at all, and or their leg. And so we may work with them on one-handed dressing techniques, prescribing adaptive equipment. We may also do activities that help facilitate brain healing or neuroplasticity so they recover some of those functions. One of the things we use for that is our BioNeck in motion robot. So it's an arm robot that we use that it helps assist their motion, but they can initiate and do some of the motion on their own.
Oh, that's good.
And that helps rewire the brain for recovery. And it's also real motivating for them because they see that they're doing something. So we'll work on that arm and try to get them to use it during their daily activities so that they can be more independent, but then the more they use it, the more rewiring they can get.
Perfect.
So that would be one example of an adult patient we would see.
Great, thank you. What about the geriatric population? We're a senior living company.
Yes.
So we have independent assisted memory care communities. A lot of times our residents will fall or have a health issue that requires them to come to even PAM rehab here.
Yeah.
How do they benefit? Like same things, same sort of
Yeah,
thing?
same sort of things. Again, we just really try to tailor it to whatever their needs are. Falls are a big thing. I think they're the greatest cause of death in people over 65 is a fall. So we do a lot of education for the patient and their family members in falls prevention and what they can do to prevent falls and to maintain them. Maintain their health so they're less likely to fall.
Again, okay.
Yeah. So we also look at caregivers too.
Educating them?
Yes, educating them. And what can we do to help make caring for your family member easier? So that's something we look at. It might be some equipment
That's what I was gonna ask,
might be helpful. It might be showing them a new technique for moving their family member, helping them dress. So a lot of times we're not just working with the patient, but we're working with their family member or caregiver as well.
That's awesome. So everybody on deck, right?
Yeah.
Well, that was a lot of information, and I appreciate you taking time out of your busy schedule to meet with me today and educate us on what it is occupational therapists do. Again, we appreciate you. We value you.
Well, thank you.
We'll help you celebrate all month.
Okay.
And honor you guys.
Yeah, thank
you. I do thank you very much, Kim, for taking time. Thank you for watching and joining us today. We look forward to seeing you all again next time. Have a great day.